conversation with Dr. Shyam, the head of the Center for Health and Healthcare at the World Economic Forum. Thank you very much, sir, for talking to Moneycontrol and Network 18. I just want to begin by asking you about a piece that I read that you had authored for the World Economic Forum. It talks a lot about where we are in terms of global healthcare, but it also has a lot of mentions about India, about how it can be a pathfinder for the global south and how it served as a trailblazer because of the Ayushman Bharat digital mission, which has already covered over 800 million people in India. So I just want to quote from your piece where you said, the lessons emerging from programs like ABDM can guide how low and middle income countries seek scalable, interoperable and affordable solutions. So can you take us through, what India, the message that India can serve in an increasingly fragmented world when it comes to healthcare initiatives? I can hold it.
Absolutely. Thank you so much, Chandra. Thanks for having me on your program. Absolutely. I think India is already serving as a trailblazer when it comes to digital health. On the overall digital economy side, India has already made great progress. And we believe from the healthcare perspective, when it comes to using breakthrough technologies, when it comes to using digital data, India is going to actually spearhead some of the work that we have ongoing with our partners in India, whether it's the government of India or whether it's the government of Telangana, and on the private sector, obviously with Apollo Hospital and others. So India is spearheading some of the global work that we are doing with some of the public and private sector partners that I just mentioned. And India is also very well known to do frugal innovation, where we are seeing the healthcare cost going out of control. We see now that the overall healthcare expenditure, global expenditure, is close to somewhere $12 trillion, $10 to $12 trillion. That's a little more than 10% of the global GDP. And it's growing very fast. It's growing at 3x of GDP. So 3 times faster than GDP. We can't continue like that. We must control the overall efficiency. We must control the overall cost. Same thing comes on the access and outcome side. So on the access side, half of the world population doesn't have access to healthcare products and services. This is coming from WHO, from World Health Organization. We see challenges on the outcome side, where we are paying for activity and not for outcome. And that's, again, obviously, overall, contributing to higher costs on the health side. The innovation that's coming out of India, the work that's going on there on the digital health side, you mentioned Ayushman Bharat Digital Mission, ABDM. That's a great example of a large public sector digital infrastructure. And that was, I believe, possible because of the digital personal identity, Aadhaar card and others that were created early on. Based on that, Government of India created this Ayushman Bharat Digital Mission. So now there is an infrastructure, and then we can use that to accelerate adoption of AI and other breakthrough technologies to solve for some of the problems that I just mentioned, whether it's on the access side, on the outcome side, or on the efficiency side. And organizations like Apollo Hospital are doing great work in that area.
Right. I have a follow-up to what you said, that India hasn't only led the charge when it comes to digital health, but it can also use some of these emerging technologies, leverage data to a great extent. Now, one of the immediate use cases for artificial intelligence and AI is being touted as, use cases in healthcare, use cases in agri. Are those still at proof of concept stage? Are we beginning to see actual impact of AI when it comes to healthcare?
I think these are already being adapted. Some of the AI technologies, especially on the diagnostic side, on the imaging side, those are already being used. But how do we scale these to so that they can reach to masses, they can reach to rural population, they can reach to all parts of the world. That's the key
Do
question.
you think it will make healthcare more affordable, applying AI?
Absolutely. If we do it right, if we make sure that there are right government policies, there are right regulations, that will make AI overall help the access part. So it can make it more affordable and it can make it more accessible. It's already helping in many areas to reach to rural populations when it comes to virtual health. Telehealth is being used now, to reach out to the remote parts of the world. So and AI and breakthrough technologies have a lot to do there. So clearly, these new technologies, machine learning, AI, and all will make the world, a better place. And starting out from the health and the security side, definitely, one of the things that we are trying to do now is look at how do we make sure that we have access to good, trustworthy health data, because as you know, AI is based on data. If you don't have good, trustworthy data, AI is not going to help much, because it's more like garbage in, garbage out. So we have to make sure that we have access to good, trustworthy health data. And so we have some work going on, working with WHO, working with other organizations, along with public and private sector, to create that interoperable, trustworthy databases that we can access to, again, build AI and machine learning on top of that. But certainly, to your question, we truly believe that AI will make healthcare much more accessible.
Right. I also wanted to ask you, memories of COVID are almost fading away from the public sphere. Are we prepared for the next big, communicable disease, non-communicable disease epidemic? Do you think, people have, or countries have slackened on that because there are so many other challenges happening in the world over? Geopolitics has sort of overtaken the narrative vis-a-vis public health.
Yes, that's a very good question. Unfortunately, the answer is no. We are not very well prepared to handle the next pandemic, God forbid, if there was one. And, the way the climate change is happening, the way we live, the way the geopolitics is causing many conflicts around the world that disrupts supply chain, that disrupts many of the trade and other things, you will see more and more outbreaks. You will see there will be disease outbreaks. The idea is, how do we stop them from becoming pandemics, full-blown pandemics? We are working on that. We are working on a global surveillance system together with WHO and CEPI and others. Again, bringing both public and private sector together so that we have a global database that can capture genomics and other data for new pathogens, new variants. As soon as they emerge, we want to make sure that we are aware of those. It doesn't matter which corner of the world. And again, AI will be a big help here. Right. Because as soon as something emerges, AI can help us track and diagnose that. And then once that data is available, then we can make that that data available to private sector, to pharmaceutical and other healthcare companies, so that they can come up with medical countermeasures, whether it's vaccines, diagnostics, or treatments. So it's really important that we work together on this. The progress has been slowed because of the current geoeconomic and geopolitical situation, but we keep pushing on that, and we hope to get to a place which will enable us a better diagnosis, better tracking of the pathogens and variants. So to answer your question, we are not very well prepared right now, but we are working toward that. That was one example on the global surveillance of the pathogens. The other example is looking at manufacturing base for medical countermeasures, especially vaccines, making sure that there are regional vaccine manufacturing facilities around the world. Right now, vaccine manufacturing is concentrated in North America, in Europe, and some parts of Asia, be it India and or China. We want to make sure that it's also available in other parts of Asia. It's also available in Africa. Right now, only 1% of the vaccines that are used in Africa are coming from Africa. It's also available in Latin America. So I think regional vaccine manufacturing is another initiative that World Economic Forum is working together with our partners, both public and private sector, to solve for some of that. So I think we will get there. We will be better prepared to handle next pandemic, but we are not there yet.
Right. There's also, a dichotomy now. On the one hand, you have aging populations. On the other hand, fertility rates are dropping for many countries in the world. What will this mean? Is enough attention being paid to both these issues?
Yes, I think both are these issues are key challenges that countries are facing right now. Just to look at the aging population, we see that close to 1 billion people around the world are over the age of 60 right now. According to World Bank and other estimates, this is going to double by 2050. So it is increasing very fast. 1 in 6 people or close to 1 in 6 people are at the age of 60 plus. And that obviously causes a lot of economic burden, a lot of health system challenges to governments around the world. We see this problem happening everywhere, whether it's a low and middle income country or it's a high income country. But it's more severe in low and middle income countries because the health systems and the governments are not equipped to handle this.
Right.
So how do we make sure that the health systems are better prepared? There are a few things we are doing. One is to focus on non-communicable diseases. As you get older, some of the non-communicable diseases, whether it's diabetes, it's cardiovascular, any sort of cardiometabolic disease, you are more prone to that. So we are looking to see how can we work with both public and private sector, make sure that there are right regulatory, right incentives, right policies to look at more preventative care, more actual health care, rather than focusing on sick care.
Got it.
Right now our health system is designed to treat the sick. We want to make sure that it moves towards prevention so that we stop people from getting sick. So what do we do about that? And some of the things that we are working again with policymakers are making sure that there are incentives for the doctors, for the physicians, for health systems to educate healthcare workers and public about prevention. Whether it's making sure that you're on the right diet, you're exercising, you are sleeping well, you have good social networks. So our initiative on health for all is focused just on that, making sure that there is focus on wellness, looking at both physical health and the mental health or brain health. So we are looking at both. On the physical health, as I said, nutrition and vitality is key, and we have a lot of work going on that, on the food system side as well.
Right. Last question. So I remember, we discussed this last year as well on longevity and the various initiatives that are happening around the world, various hypotheses that are coming out. In the last year, there was a lot of chatter in India about this anti-gravity aging hypothesis. Do you think there's been enough advancement or research around longevity, and where are we at there in terms of extending lifespans?
Yes, I think there's work going on there. I don't think that we have answers to that, but we can, as I mentioned earlier, we can certainly focus on some key basic things. We do have this longevity initiative within the Center for Health and Healthcare at World Economic Forum. We are looking at, healthy lifespan, not just increasing the lifespan, but increasing the health span, so that we spend more of your life as a healthy, productive individual. And there, again, the best thing would be to focus on basic things. You're looking at, making sure that you are getting enough, energy. You are focused on, as you age, especially, you focus on getting enough protein and fiber in your diet. You focused on exercising minimum 30 minutes a day or about 150 minutes a week of exercise. You get proper sleep, 7 to 8 hours. Absolutely no tobacco and no alcohol. Actually, tobacco is the biggest killer, as you know. It causes more deaths than anything else. So, you are looking at a tobacco-free world. If we can get to that, that would be great. And then alcohol, So these are some of the things, the basic things that we recommend, and we recommend people to focus on. But also, we are finding out through many research that building social networks, making sure that you have a strong mental health. You avoid depression and anxiety, and that comes from social networks. So these are some of the basic things. Of course, there are many other research and many other things going on, but nothing conclusive yet.
Great.
Okay.
On that note, Dr. Bishen, thank you very much for talking to Money Control. Thank you.
Thank you.